ahead and start. I actually would like to make a shout out to all of our nurses, anybody who might be listening, and also to Diana and Rosie. This is National Nurses Week. Clearly, tough time for a lot of nurses. I have two daughters-in-law that are nurses working out in the hospitals, and they are very, very strong women, and I give them a lot of credit. So I appreciate all that you do. Okay, so I think we're going to start now. I just want to welcome everybody. Some of you may have been on our previous webinars, and so the first few minutes might seem like a bit of a repetition, but we want to make sure our new people have a good understanding of what we're talking about. So there will be a little bit of repeat for the first few minutes. We're going to cover, this is all about PRP, and are all PRPs the same? And we hope that when we're done here, you'll understand that in fact they are not the same, that they vary a great deal in how they're performed and the results that can be obtained from different PRP treatments. It's a new method of treating hair loss. New meaning in the last 5 years, really. It's been becoming more and more popular. But we'll talk about all the changes that are taking place. Again, a few minutes of background on female hair loss. We'll talk about the history of PRP, how and why the protocols seem to be different. We'll talk about something that we developed, which is optimal platelet concentration therapy. We'll show you some of the treatment results that we've gotten, and we will leave time for questions and answers at the end. We hope to get to everybody's questions before the hour is up. Just to introduce ourselves, I'm Dr. Mary Wendell. I'm the medical director of Medi Tresse. Online with us, we have Diana Gallerani, a nurse practitioner, who is the director of clinical services, and Rosie Scano, who is our clinical nurse specialist. Between the three of us, we have decades worth of experience treating hair loss in women. Yeah, this is the Medi Tresse update. In Massachusetts, we hope to be open by the 18th. The governor is telling us that he's going to start to open up some services, and we're planning on being there. Initially, we are going to concentrate on our treatments. We have a lot of people who have had their treatments on hold. So we will continue to do video consultations as well as video follow-ups through the month of May. We will sort of see how things go as time goes on. Whether we'll need to continue video consultations beyond the end of May, we'll have to wait and see. But we really do recommend, if you're interested in coming in to see us, if you have not been in, that this is a great way to get to know us, to have a consultation, to get your treatment going. We are able to ship products to people. So if we find that it's something that you need or have already been using and you need more, we can ship everything out to you. Okay, again, brief physiology lesson, which is important to understand how PRP works. Okay, just briefly, the hair life cycle. As you can see on the diagram on the right, the hair cycle has 3 parts to it. The anagen phase is the growth phase. It's the longest phase. That's where your hair grows for a period of anywhere from 2 to 5 years. Little girls, their hair probably grows even longer, which is why the hair can be all the way down to their waist and beyond. As we age, the growth cycle shortens. It also shortens with different diagnoses of genetic hair loss in particular, and so the hair falls out faster than it would have when we were younger. Following the anagen phase is the catagen phase, which is where the hair gets prepared to release that hair. There's no further growth. It's a transition into the shedding phase, which is the telogen phase. This is the resting phase. The hair falls out, and then the follicle will rest for 3 to 4 months until it gets prepared to grow a new hair. Again, over time, due to genetics, it's possible for the entire hair life cycle to shorten. This is something we see frequently, and it presents as increased shedding. Types of hair loss in women, the most common types are the non-scarring alopecias. Androgenic alopecia is by far the most common. It's also known as female pattern hair loss. Telogen effluvium is excessive shedding. As I said, that telogen phase is the shedding phase. There are a variety of reasons why you can get stuck in the telogen phase. Traction alopecia is hair loss as a result of harsh hair care practices. It's most typically in the front. We do have some photos of that later. And it's due to pulling, and it actually can damage the hair follicle. Alopecia areata is the spots of hair loss, where it actually starts looking like usually coin-sized lesions of bald spots. Fortunately, the hair follicle is still alive, and treatment can sometimes be successful. We also treat post-cancer hair loss, and there are a variety of reasons why hair loss can continue even after chemotherapy and radiation has finished. So we do have a fair amount of expertise in treating that as well. Scarring alopecias are a type of hair loss where the hair follicle actually is destroyed, and unfortunately, treatment really is at trying to prevent further loss and getting those hair follicles before they're really damaged. We're seeing more and more of scarring alopecias. We're not sure why that's happening. There's some debate about whether it's some of the cosmetics that we use, but right now I can't honestly say the reason for the increasing amounts of scarring alopecia. When you come for an evaluation, particularly in person, the first step is getting a good medical history. We talk about your hair loss history, your medical history. We do a careful examination of the scalp with trichoscopy, which is a magnification. We can actually look at the hair follicles and see what shape they're in, if there's any damage or inflammation there. And we can see if there's something called miniaturization, which is the shrinking up of the hair follicles. Sometimes we will recommend blood work, depending on what we think is going on. We rarely do a biopsy, but once in a while, less than 5% of the time will we consider doing a biopsy. The treatment plan can vary greatly depending on the cause, which is why we believe that anybody who wants treatment for hair loss should really have a thorough evaluation by a specialist who knows about female hair loss in particular. Okay, PRP, or platelet rich therapy. We're going to talk a little bit about our experience with PRP therapy. We'll explain what PRP therapy really is, how it's used for hair loss, and the different types of other treatments and how it compares. Okay, our experience with PRP therapy. We opened up in June of 2015. Even at that point, some of our staff had already had experience performing PRP for a while, even before we opened it in Wellesley, our first office. Since that time that we opened, we have done over 2,500 PRP treatments and treated over 650 patients with PRP. So we're pretty experienced in what we do. Okay, what is platelet rich plasma? And I will refer to it as PRP. It refers to that portion of the centrifuge blood that contains the highest concentration of platelets, and surrounding the platelets are growth factors, cytokines, and other plasma proteins which help in cell growth. The way we get the PRP is we perform a simple blood test, just like if you were at a lab. We take the tube, spin it down in a centrifuge, usually twice, and then we separate the components. And you can see on that diagram on the right where the PRP, the platelet poor plasma, is there, but the platelet rich plasma is in the middle, and that has the highest concentration of the plasma and all the growth factors that we're looking for. The red blood cells get centrifuged to the bottom. Depending on which protocols we use, the platelet concentration in the PRP can be 2 to 10 times the baseline concentration of your normal platelet counts. We'll talk about that a little bit later. PRP was first developed back in the 1970s to treat patients with low platelet counts. There are a lot of medical issues that can result in low platelet counts, some medications, as well as some diseases. The platelets are very important in our body. They help prevent further bleeding. That's what most people know about, but it's also the platelets' role to bring growth factors to wound areas to help in healing. Once this was discovered, scientists realized that you could use the PRP therapy and use the PRP therapy for a variety of medical procedures, including facial cosmetic procedures, dental surgery, cardiovascular surgery. Orthopedics and sports medicine is one of the bigger areas where it's been used a lot. Dermatology is beginning to use it not just for hair growth, but for scar revisions, wound healing, and there are other medical specialties as well. So it's becoming more standard care for some specialized diseases. PRP for hair loss is relatively new. The slide here says it was first utilized in 2004, but it really wasn't utilized a lot until probably the last 5 to 6 years. There's been more and more studies on it, which is great. And studies have shown that up to 85 to 90% of patients experience some degree of new growth with PRP treatments, which correlates with increased hair counts, increased hair widths, and stronger, healthier surrounding tissue, which is another part of the benefits of PRP. It doesn't just stimulate the hair follicle, but there are growth factors in there that actually stimulate the tissue surrounding the follicle to support better hair. It utilizes the growth factors that are surrounding the platelets that are in your own blood to promote this growth and healing. The PRP stimulates dormant or miniaturized follicles to grow, becomes them healthier and fuller, and that translates into healthier and fuller hair. PRP has been studied extensively, particularly for androgenic alopecia, where it's become nearly standard treatment for androgenic alopecia. Also success in traction alopecia, and there has been some success as well in alopecia areata. We have also started treating scarring alopecias with PRP. We use PRP in addition to other treatments to help the scarring alopecia stabilize and then sometimes get some regrowth, which is amazing. So how is PRP therapy performed for hair loss? It's a fairly simple procedure. It takes less than 60 minutes. A simple blood test is obtained and spun in a centrifuge, which separates the PRP into those levels that I demonstrated before. Prior to treatment, the scalp is anesthetized so that when the actual PRP is administered through the scalp through a series of injections, there's no pain at that time. We then do produce microtrauma to the scalp, which activates the PRP and stimulates the platelets to do their job. The expected recovery time, the pain is easily managed with Tylenol. There can be some occasionally 4 to 6 hours after the injections, and this will usually resolve within 48 hours. There can be some bruising. Again, it's usually minimal. You can drive home immediately following the procedure, and you can shower and wash your hair later that day. Okay, I just want to make a quick comparison between other types of treatments that you might be aware of. PRP versus PRF versus adipose stem cell therapy. In recent years, practices started offering PRP in addition to platelet-rich fibrin therapy and adipose stem cell therapy. Platelet-rich fibrin therapy is very similar to PRP. However, there's no anticoagulant used. The PRF, the platelet-rich fibrin therapy, also uses calcium chloride, which we also use in the PRP, but we do use anticoagulant. The idea with the PRF is that a fibrin matrix is created. In other words, a thicker matrix is created that slowly releases the growth factors over a slower period of time. This is a very much newer treatment compared to PRP. There has not been nearly the same amount of research done on it, and there have been no comparative studies to PRP to prove that it's any better than PRP. We are not utilizing this treatment at this time. Again, there's not been enough research on it done. And so until we see more benefit than what we're doing, we will not change to that type of treatment. Adipose stem cell therapy, a lot more of you may have heard about this. It's a more invasive treatment that involves actually removing fat cells from the stomach in a similar mechanism that liposuction does. And then those cells are manipulated, the stem cells are obtained, and then later injected into the scalp. You can still see some places are doing this, but they're unfortunately, or fortunately, depending how you look at it, there's a lot more FDA scrutiny on this procedure. There have been a lot more complications as a result of this. The FDA now classifies adipose stem cells as a drug, which means it's under their ability to control and manage. And so right now they're not, they're trying to actually prevent further adipose stem cell therapy from being done. However, it's still It's still occurring in some places, but I would tell you that it's probably not going to be available much longer, with good reason. There is limited research on the benefit of this treatment for hair loss as compared to what we're already doing with PRP. Okay, I'm going to hand this over to Diana now. She'll talk about the how and why PRP protocols differ, and we'll move on from there.
Hey everybody, thanks for joining us today. So I'm going to get into, like Dr. Wendell said, the how and the why PRP protocols differ, and why we do what we do. So this section will address how the protocols differ, why the protocols are different, the challenges for patients, and the recommended protocols. So how do protocols differ? So there have been hundreds of studies on PRP therapy for hair loss, but the treatment protocols can differ significantly no matter where you go. So, and the reason for this is that there are no standards for anticoagulant use. There's no standards for how much blood should be drawn. There are no standards for single versus double spin. The amount of PRP that is used in each treatment, the dilution of the PRP, which activator is used. So there's different ways that we can activate the PRP to start working. The extracellular matrix, should it be used, should it not be used? How much of the final product we actually inject, how microtrauma, is that used or not used to activate the PRP? And the number of treatments required and how often to give them. So why do these protocols differ? So the biggest reason is that PRP therapy uses the patient's own blood as the medication. So it is regulated, it is not regulated by any government agency the way that other treatments are. The PRP kits that are used are registered with the FDA and must follow strict guidelines for safety. The research on PRP has been driven by physicians utilizing the treatments in the PRP kit manufacturers. So, that can be, we have to really look at the research and see who are the ones doing it, and that is always a factor in how we look at the data. Protocols have been evolving as well as we have come to better understand the power of PRP and the best way to use it. Regenerative medicine is still fairly new, and too often the protocols are being driven by the PRP kit distributors on their in-house research. So this is something that definitely was a challenge for us when we were looking into potentially upgrading our own PRP systems. When you talk to different companies, the research that you're getting often is done by them and not as easily compared to other companies. So that's something that we really had to take a good look at and sort out for ourselves when determining what our next step was with PRP therapy.
Diana, excuse me. I just want to make an announcement, which I forgot to do earlier. At the bottom of the screen for our participants, there's a question and answer area where you can type in your questions, which we will get to at the end of the webinar. I apologize for not letting people know ahead of time. Just wanted to let people know. Thank you.
Yep, thanks. So the biggest challenges for patients is that not all PRP therapy, like I said, is the same, but it is being marketed as such. So this makes it challenging for patients. There's a variety of different places that you can go to now to get PRP, and consumers don't always know what it actually is that they're getting. And it's not always the right treatment for every single patient. We do really comprehensive screening. We don't do PRP for anyone that has not yet had a consultation with either myself, Dr. Wendell, or Rosie. And so the most important step is really to get that consultation to make sure that the type of hair loss that you have is diagnosed and that PRP will likely give you some benefit. The other thing to take into consideration is medications. And so sometimes there are medications that can inhibit the responses of PRP. And so that's something that we will look at and advise you on after your consultation. PRP therapy for hair loss is starting to get a poor reputation, as many practices are not properly evaluating patients for the cause of their hair loss. We've been seeing this a lot. We get a lot of patients now that have gone other places and have come to us not ready to give up on PRP yet because they have read the research and see that there's a benefit, but they didn't necessarily achieve a benefit somewhere else. So they come to us as kind of a second opinion to take a look at it again and talk about our protocols and try again. And some patients have had some success by doing this. So it's really important to make sure, we've even had some people going to really reputable places. So, and it doesn't always mean that they would have responded. There are some people that don't respond, but you definitely want to make sure that you're getting treatment from somewhere that really knows what they're doing. And again, experienced. So you want to make sure that the practitioner is experienced with both PRP therapy and treating hair loss. And this should be a big factor in your decision. A lot of people are now turning to med spas because they do offer a variety of things. And so sometimes they are able to price things a little bit more competitively, but they're not always doing PRP every day. We do a lot of PRP. We usually do, one practitioner can sometimes do up to 7 or 8 treatments in a day. So we do a lot of it. And then realistic expectations. We always want patients to have realistic expectations, and we work really hard to try to set those expectations. Results can vary from person to person. So, it depends on how long you've had the hair loss, how progressive it is. We always want people to have realistic expectations and also choose a realistic treatment plan. Sometimes if there's a lot of loss, we always recommend doing more than just PRP, but if somebody has really extensive loss, you really want to strongly consider doing everything. In some cases, we might recommend a hair transplant, not always in minimal situations, but that can be a factor. So recommended protocols. So the October 2019 edition of the Journal of Dermatologic Surgery, titled Platelet Rich Plasma as a Treatment for Androgenic Alopecia, reviewed 10 of the most substantive studies on PRP as a treatment for hair loss. So this study did provide the following recommendations: the initial treatment series of 1 treatment a month for 3 months, maintenance treatments after the initial series, activating the platelets with calcium chloride or scalp needling, and optimal concentration of platelets 1.5 per billion per ml. So these are things, our protocol, we do a series of 3 treatments that are spaced over a 3-month time frame. We recommend booster treatments for maintenance every year, sometimes every 6 to 12 months, depending on the circumstances. We activate our platelets both by using calcium chloride as an activator and by scalp needling. And we, with our optimal platelet concentration therapy, we do get between 1.4 and 1.6 billion platelets per ml. Sorry about that. And we'll talk about this a little bit further too. So optimal platelet concentration therapy. This is something that we researched in the office. So we're going to talk about that. We're going to talk about why it was developed, how it's different from PRP therapy. And so we do both PRP therapy and optimal platelet concentration therapy. So studies have shown that between 1.4 and 1.6 billion platelets per milliliter is the optimal concentration for PRP. And so we actually did our own internal testing. We looked at a number of the top PRP systems. We actually had those reps, we started with getting their research. We wanted to see what the studies showed. And so we were finding that, in these cases, the studies were done by the companies that were putting out the systems, and really looking at the data, how many platelets were they getting, things like that. And so we found this to be a little bit challenging in terms of comparing different PRP systems across the board. So we then took it a step further and tested them in our office so that we could obtain our own data and compare one to the other. So what we did was we tested by taking platelet counts before and after spinning to determine which machines could consistently deliver the best concentrations. What our testing showed us was that many of the systems cannot deliver optimal concentrations, meaning that we're not getting that 1.4 to 1.6 billion platelets per ml. Many of the systems deliver inconsistent results, so they're not always, some will deliver anywhere between 2 to 10 times the baseline concentration, and a lot of them it's varied in what they're delivering. Sometimes you get 2, sometimes you get 3, sometimes you get 4, and so we really wanted something that was going to give us consistency each time. And then the other factor is that everybody's platelet count is different, and that platelet count can actually vary from treatment to treatment. So a big piece of this for us was actually being able to get a platelet count, which we now are able to do. When we do OPC therapy, we test the platelet count with every treatment so that we know what it is on that date. So why did we develop OPC therapy? So in 2018, we started having some discussions about our protocols due to what we were seeing in the latest studies and conferences that we had been to. And we were talking to other colleagues in the field to see kind of, what other people were doing, what knowledge they had, and kind of going from there. So at the time we were having good results with PRP, but the results were really varied, which was very frustrating to us because obviously when somebody comes in and is taking this next step, we want everybody to have a really great result. And we were starting to suspect that the platelet count had a lot to do with this. We knew that every patient was unique in terms of their platelet count, but we were essentially giving the same treatment to each patient. The protocol was the same. And so everybody would, you'd come in, we'd draw your blood, we'd spin it, and we would inject the same amount from person to person. More research was coming out at that time about the importance of the 1.5 billion platelet concentration. In early 2019, we did release OPC therapy after, like I said, testing all of these different kits. We purchased a platelet counter. We were testing platelet counts on patients that were giving us consent and also on staff to really test this out and see how this would work. So what makes optimal platelet concentration therapy different from PRP? So a few things. Platelet count is taken with each treatment to determine the baseline count at the time of treatment. Like I said before, your platelet count can actually vary from treatment to treatment. So this can change the amount of PRP that's needed to get you to that 1.4 to 1.6 billion platelets per milliliter. So based on your platelet count that day, we actually customize the volume that you're getting to deliver that 1.4 to 1.6 billion platelets per milliliter. And we optimize the final solution. So depending on your count, we can dilute it more or concentrate it more to give you that concentration needed to actually create angiogenesis, which is a fancy medical term for repairing the blood vessels at the site of the hair follicle. So treatment result expectations. So goals of treatment and expectations and before and after pictures. So it's really important for people to have realistic goals because like I said, the treatments can vary from person to person. So, but overall we do see really positive things from PRP and OPC therapy. We expect that over 85% of patients are going to have a positive result. Now, what is a positive result? A positive result can be anything from a minimum of halting the progression of any future loss. Most types of hair loss are progressive. So if, we have a woman that comes in at, 40 that we're able to stop the hair loss, it's going to change the trajectory dramatically for when she's, say, 80. So that's a big factor in successful treatment. The other thing that we often see is slowing down or stopping of excessive shedding, decrease in miniaturization and increased hair diameter. So when the hairs are undergoing the androgenic alopecia, they're actually miniaturizing or thinning out. So one of the most common things that we see with these treatments is the diameters of the hairs actually thickening. And then in many cases, we also see regrowth. So a positive result can be one or a combination or all of these things. And this is going to vary from person to person. Now, again, this has come back to evaluation. It's very, very important. We always say to be evaluated for your hair loss. We want to make sure that you are somebody that is a good candidate for treatment. And if you're not a good candidate for treatment, we are going to kind of advise you on some alternative options. And sometimes people want to try PRP anyways, and that's okay, but we always want to make sure that we're having a conversation with you about any potential barriers to successful treatment. So these are some before and after photos. So any patients that have seen me before know that I have a love-hate relationship with before and after photos, because I think obviously anyone looking at this can see that the results that this person had are truly amazing. And that's one of the most exciting things for me as a provider, and also for the patient to be able to see these before and after photos. But sometimes I worry that seeing this will create some unrealistic expectations for people. And so you always want to be realistic in your expectations, because successful treatment, we see situations like this often. And some people we just see halting the progression of future loss, and some people we get less shedding, some people we get some thickening. So this is truly a very exceptional before and after photo, and not something we always see, but often we do. So this patient had 3 PRP treatments. They had androgenic alopecia, and those were at 12 months. This next patient also had 3 treatments. This was also androgenic alopecia, and this was before and after at 12 months. This patient also had PRP 3 treatments, and these were also for androgenic alopecia at 12 months. This was before and after for OPC 3 treatments, and also a combination of low-level laser therapy. This was at 6 months. So we expect, the results take around 6 months, sometimes a little bit sooner. Sometimes they can take a full 12 months. So oftentimes people, when we get those photos at 6 months, in many cases, we do see further improvement by 12. So this is a really good result for 6 months. This is a before and after 3 PRP treatments at 12 months for traction alopecia. So this is that type of hair loss that Dr. Wendell was talking about, where there is pulling, like tight braids, tight ponytails, and we see the hairline moving back. So that's another type of hair loss that can actually benefit from these treatments. This is truly amazing. This is PRP for alopecia areata, which is the type of hair loss that Dr. Wendell was talking about, where we typically see coin-shaped lesions that are starting to open up throughout the patient's scalp. Somebody that's had alopecia areata for a long time, we see those lesions opening up wider and wider. And so this was somebody that had really substantial loss, and had really, really successful treatment with PRP. So this is truly amazing. I still get chills when I look at these pictures. This was a patient that we had treated for scarring alopecia. So this was central centrifugal cicatricial alopecia, which up until this patient, actually, I believe we hadn't treated anyone for any type of scarring alopecia with PRP. There's not a ton of research on this, but this patient was very persistent that she wanted to try it, and was understanding that we weren't promising anything. And she actually did have a very successful result, as you can see, and in a pretty short time frame. So this actually did prompt us to try PRP on other types of scarring alopecia. And we've had some success with this, but not always. Kind of like with anything, with androgenic alopecia, it's not 100% either. So we've definitely started to treat more scarring since this patient in particular. So now we'll open it up if anybody has any questions. I'm going to take a look. It looks like there are a few that have come in here. So someone asked, what is the main difference between OPC and PRP? So again, just to review, the OPC, we take, we draw more blood. We are able to extract more platelets out of that blood sample by getting more blood, and also by using a better centrifuge. The centrifuge that we use does spin the blood twice. It's a double spin versus a single spin with the PRP. And we take that platelet count. So we get a platelet count. We know what your platelets are. We are actually able to then give you more or less depending on what the count is so that we can get every patient to that 1.4 to 1.6 billion platelets per milliliter. The typical length of treatment, so each treatment, we do a series of 3 treatments, so most people get that initial series done in, it's at 1 treatment every 4 to 6 weeks. So sometimes people are in and out in 8 weeks in terms of their treatment. Sometimes it takes that full 3 months. And then we do a follow-up visit at both 6 and 12 months for evaluation. And then going forward, people will do 1 booster treatment every year to 6 months, depending on the situation. Okay, so somebody wrote in they have androgenic alopecia as well as telogen effluvium, had hair shedding post-PR treatments, but not shedding post the optimal PRP, OPC, but continue to have chronic TE. Should I get an annual booster of the optimal? I think that is something that should, if you're getting results, then yes, and that's something that needs to be decided from case to case. So that would be something that, those follow-up visits every 6 months are going to be really important for continuing to evaluate and to see via photos if it's effective. Oftentimes there is some benefit there, but people are continuing to see a lot of shedding when they have telogen effluvium as well. So that's something that usually we handle kind of case by case. What impacts the platelet level that each person produces, and is there anything that you can do to increase your platelet count if it is low? The biggest thing, a lot of it is just you get what you get in terms of platelet count. We definitely do see like people that smoke, that can impact the platelet count. If people are ill around the time of treatment, that can negatively impact the platelet count. And so that is something definitely to consider. If you're not feeling well or you're just getting over something, give us a call so that we can try to adjust your time, your treatment. We have a 4 to 6 week window, so sometimes it might mean that we'll hold off to that 6 week window just to make sure that you're feeling a little bit better. The other thing that we can do in the office is when we are doing an OPC treatment, we get that platelet count. We know what your count is going to be and how much we need to give you. And sometimes, particularly for patients in the low 200s and less than 200,000 platelets, sometimes we do recommend actually using 2 kits. So it would be a double blood draw. It's going to be a little bit more expensive because we do have to factor in the cost of the kit and the additional supplies, but that is a way for us to get you more platelets. Somebody before asked about the cost of treatment. It depends, whether it's PRP or OPC. If you're using an extracellular matrix, we use BioD. So all that contributes to the cost. So it can be, as cost effective as $2,500 all the way up to $4,200, depending on what you choose. What percentage of cases have successful results with PRP? What percentage see growth? So typically, the clinical research shows about 85% of patients getting benefit. We, for a while, were seeing between 90 and 94%, and I think that is because we screen really well. Growth is kind of tough to speak to percentage because I think the majority of what patients see is thickening. So it's not always something where we're pulling out growth versus thickening. We really look at those before and after photos to see, what people are seeing. So again, somebody is asking about what we're doing for reopening the office. So right now our plan is to open on May 18th. We are in the process of rescheduling any patient that was scheduled prior to May 18th. We are in particularly scheduling the treatment. So anybody that was a first, second, or third treatment, followed by booster treatments, those patients are all being scheduled first. We are leaving some space in between each patient to thoroughly clean the office down. And so that is something we won't be seeing the same number of patients. So we're just asking that everybody is a little bit patient with us. We're continuing to do the follow-ups and consultations via Zoom, just so that we can limit the traffic in the office. We will be asking all patients to wear face coverings. Staff will be wearing masks. And we're going to be asking you to wait in your car until, we'll call when you get there, and then we'll kind of limit the flow of traffic that way. We want to make sure that everybody's safe and that there's no additional people in the office that don't need to be there. So if you have somebody that's coming with you, they will need to wait in your car. And anybody that has specific questions about that too, you can always email us or call us. We'd be happy to go through that again with you. But if you had a treatment that was affected, we will be calling you to reschedule in the next few days. Medications that can inhibit the response to PRP. So the big ones are testosterone therapy, which is something that women are often on as a hormone replacement therapy. So that's a big one. Any like immune modulators, oftentimes like treatments that are being used for autoimmune diseases. Those are the big ones. There's some others, but those are really kind of the big ones. And then, from patient to patient, depending on the situation, and sometimes lab work will factor in. So if you have a specific question, it's something that we can definitely talk to you about and take a look at your medication list. Is it ever too late for PRP? Yes. So most women are really good candidates for PRP because the way that women thin out versus go bald like men. So most often PRP can benefit women. But sometimes, if you have a lot of scalp showing through, or like particularly with traction alopecia, for anybody that's had traction for a very long time, typically we say the general rule of thumb is about 5 years or longer in terms of having follicles that are not producing hair. But with androgenic alopecia, there is some wiggle room, just because most women don't have follicles that stop producing hair from day one. It's a gradual miniaturization of the hair follicle to the point where the follicle then stops producing. So for most women, they will get some benefit from PRP, but an in-office consultation will definitely help us to determine if it's likely that you'll see success. And then the other thing is just people's goals for treatment. That's really important. If somebody comes in with a lot of loss and tells us, that they want to get 100% of their hair back, we're going to tell them that that's absolutely not possible with these types of treatments. And in that case, we might consider a transplant. But most women don't need a transplant. They opt for these non-surgical treatments, and they do see results. Someone asked, what is the best therapy for androgenic alopecia when Rogaine hasn't worked? So the best treatment plan for androgenic alopecia is really a combination of treatments. It can be, we like people in a perfect world, if money was no object, to do OPC3 treatments with a laser cap, a topical, and a supplement. If somebody were to just pick one thing, it would be typically OPC first, with PRP second, and laser third. Okay. Let's see, okay, so we answered that. How long after a consultation can treatment begin? Usually fairly quickly, depending on scheduling. Right now, we've been doing video consults, and a lot of people have been booking based off a video consult. In most cases, we're able to determine what type of hair loss you have, but we will need to allow a little bit of extra time in the office that if you decide to move forward with the treatment, so that we can just, put a microscope on there and take a good look and make sure that our diagnosis is correct. Right now, for anybody starting a new treatment, we're scheduling for June. Any side effects? So somebody's asking, are there any side effects for existing medical conditions that come into play decision-wise? So yeah, so again, it can be medications, it can be, sometimes poorly controlled diabetes, autoimmune diseases. There are a lot of different things that can potentially impact. So it's something that, we would need to see each person for a consultation and go through all of these things and determine, what the likely benefit would be. Dr. Wendell, did you have something to add to that?
No, no, thank you.
Okay, so someone asked, how is it handled if you are if you're tough to draw blood? So, I mean, Rosie and I do all the treatments. We draw a lot of blood. You know, we're pretty good at it. Every now and again, we do get somebody that is a challenge. If we know right off the bat that you're a difficult stick, we probably will try to schedule you on a day where both of us are in the office. That way, you know, sometimes if one of us can't get you, the other one can. The other thing that's very important is to drink a lot of water the day before treatment and the day of. The more fluids you have, the less dehydrated you are, the plumper your veins are. So usually we don't have an issue if, you know, if one of us can't get you, usually the other one can. So that's typically how we do that. What if you perm your hair? Can you do treatment? You can. I mean, we ask, you know, in a perfect world, nobody would do any chemical treatments that can damage the hair, but you can still perm your hair. We just ask that you avoid perming for a week after treatment and for a few days before. Someone asks, I had radioactive treatment to destroy my thyroid gland at age 22. I am now 47 and have been on thyroid hormone replacement therapy since then. Would that affect platelet count? Can I still be a candidate after diagnosis of hair loss reasons? As long as everything is stable now, if your TSH levels are stable and there aren't any issues, you can be a successful candidate for treatment. I don't believe, Dr. Wendell, can that affect platelet count? I'm not aware.
I'm not aware that it does, no.
Okay.
So, you know, unless you have an additional autoimmune disorder that sometimes can affect the platelets, but that's not typical, no.
Okay. Dr. Wendell, do you want to address a ballpark cost for hair transplant?
Sure, I'll do that one. Yeah, I mean, it's going to sound like I'm being evasive, and I don't mean to, but the cost of hair transplants is totally dependent on the size of the area that is being transplanted. It can vary anywhere from, say, $4,000 up to $7,000. It's totally dependent on the size of the area being transplanted. And also the other factor is where the hair is being transplanted from. There are two different techniques of getting the hair to be transplanted. And so if we do it individually, one hair follicle at a time, because of your particular case, that's a little bit more expensive than if a strip can be removed and then individually cut up to single follicles. So I know I'm sounding evasive, don't mean to be, but it's extremely variable. And but I would say, again, anywhere between $4,000 and $7,000, depending on the size of the area being transplanted and the type of transplantation being done.
Someone asked, does health insurance cover the procedures? Typically no, because it is cosmetic. Someone asked, the same hold for coloring your hair? Is there a period you should wait before treatment? We usually what I tell patients is no coloring for 7 days after treatment, and then you can color before treatment. We just want you to color in advance enough so that you can wash your hair before you come in for a treatment to get all of the color off the scalp. So usually, you know, like 48 hours in most cases. Somebody asked why medical insurance doesn't cover any treatments, because they deem it as cosmetic. So, and even so, I think the other factor is probably FDA. I mean, I know that for orthopedic things and any reason why people are doing PRP, it's not covered. So when patients have orthopedic injuries and they're getting PRP for this, their insurance is not paying for it, unfortunately.
Yeah, it's really unfortunate that even post cancer treatment, hair loss is not covered by insurance. Insurance will pay for a wig during treatment. They won't even pay for wigs after treatment if a woman decides she needs to continue to wear one. So unfortunately, even in those circumstances, insurance will not cover it. So again, it's unfortunate, but that's the status of things right now. Did we answer all the chat questions? It looks like on my
Yeah.
screen anyway, it looks empty. So are we good with those? Yes.
It looks like it.
Okay. All right. Well, I think that's it for now. I just want to thank everybody for joining us. If you have further questions, certainly go to our website and you can email us, call us anytime. We would be happy to speak to you. We're continuing to do weekly webinars until we open, so just keep your eyes open for the, oh, somebody, another one more question just popped up. Let me see. Oh, no. Somebody asked, is the cost $2,500 to $4,200 per treatment? No, that's for the series of the PRP and OPC. That's the cost for the 3 treatments. So that's for the series. Sorry about that confusion. Okay, I think that's it. Does anybody have anything else to add here? Okay, well, thank you, everybody. We appreciate your time. And if you have any questions, give us a holler. And stay safe out there. Take care. Bye-bye.
Take care, everyone.